I will be describing using an AED for an adult and then giving the differences for a child. So you'll want to complete your check and call steps. As soon as your AED is available, you'll want to turn it on. There will be a voice speaking to you. You'll want to be able to follow the prompts. So you'll want to remove clothing of the individual and attach the pads to their chest correctly. If necessary, you'll want to wipe the chest dry. That's a very crucial point. You don't want any sort of liquids to cause further damage. You'll place the one pad on the upper side of the chest, and then you'll place the other pad on the lower left side of the chest, a few inches below the left armpit. If the pads may touch, place one pad in the middle of the chest and the other pad on the back between the shoulder blades. You'll want to plug in the pad connector cable to the AED if necessary. Prepare to let the AED analyze the heart's rhythm, and then you'll want to make sure that no one else is touching the individual when you're performing this. You'll want to say clear and a loud and commanding voice. Deliver the shock if the AED determines one is needed. Make sure, again, no one is touching the individual. You'll want to say clear and a loud voice again. Push the shock button to deliver the shock. After the AED delivers the shock, if no shock is advised, immediately start CPR, beginning with the compressions, if that did not help the situation. For a child, you'll want to use the pediatric pads, which are going to be different from the adult. They're a little smaller. They're also built for a younger individual. And you'll perform the exact same situation, but you'll want to make sure that the pads are not touching each other. You'll have a smaller chest situation. So you want to make sure that they're placed correctly, but you want to follow the steps and you want to be more careful because of the more delicate situation.